Hi and welcome. I'm trying to learn medicine. Today, acromegaly. And after we've done it, we're going to do backstretching. If you participate in the backstretching, then it's at your own risk. And this is also no medical advice, so we're just reading what is written here. And this is about a disease. Acromegaly. That is a disease in which the skin thickens and the hands, feet and face, in particular the lower jaw, enlarge. Okay, that is a disease in the hands are getting more thick, the feet and also the lower jaw, the face, in particular the lower jaw getting bigger. It's the result of overproduction of growth hormone by the pituitary gland, which lies in the brain. So here we have it. In the brain there is a region or a gland, there's a place that is called pituitary gland. Pituitary gland. Pituitary gland. In the brain there is something called pituitary gland, and by acromegaly, it is producing too much growth hormone, the hormone in the function of doing growth, too much of it, and then the hands, the feet and the lower jaw enlarge too much. A benign, that is a non-cancerous, tumor of the gland causes the excess production. Okay, benign seems to mean more or less always non-cancerous. There's a benign tumor. So there's a tumor at the gland. It's not a cancer tumor, but it is a tumor. And at this gland, the pituitary gland in the brain, there's a tumor, and that causes it to produce too much of the growth hormone, which then lets the feet, hand, and lower jaw grow. Treatment consists of destroying the tumor by radiotherapy or by removal of the gland. Okay, either the radiotherapy, there is the tumor destroyed, or the whole gland removed to treat it. The acromegaly. Acromegaly occurs after the age at which normal growth stops. That's interesting. Okay, it destroys. It comes after the normal age has stopped. That really makes sense. Excessive production of growth hormone in children produces a different condition, gigantism. Okay, if the pituitary gland is producing too much growth hormone during the ages of growing, during childhood, then it gives gigantism. And if the pituitary gland produces too much growth hormone after the normal growing has ended in the teenage years, then it produces acromegaly, and that is an enlarging of feet, hand, and lower jaw. Now, that is all what was it to acromegaly. If you were here for medicine, you can go directly to the next part. We will do now the backstretching. If you participate in the backstretching, then it's at your own risk. Go to stable stand, legs shoulder forward apart, we're breathing in and lifting the arms up. And breathe out, go over to one side. Breathe in and out the rib cage. And breathe again out. Again in. And out into the middle. Breathe again in. And out to the other side. Breathe again in. And out. Again in. Out back into the middle and the arms down. Next exercise, no one sees your drop, go to stable stance. We're breathing in. And breathe out, and one hand slides down the neck, and the other shoulder stays down. And breathe again in. And out, and we're taking one arm over. And breathe in and out in the ribcage. And breathe again out. Again in. And out back into the middle. And breathe in. And out, one hand slides down the leg. The other shoulder stays down. Breathe in. And out, we're taking one arm over. Breathe in and out the ribcage. Breathe out back into the middle. And now the aerobatic aeroplane. The feet are standing here. We're breathing in, lifting the arms up. And breathe out, one hand comes down. Breathe in and reach. And out, hanging it up. Again in. And out, one hand down. Breathe in and reach. And out, hand up. And another round, breathe in. And out, one hand down. Breathe in and reach. Again out. Again in. And out, one hand down. Breathe in and reach. Again out. And the arms down. And now, feet are standing still together. Breathing in, lifting the arms up. And breathe out, we're doing the crab in the morning. The ribs together. No, not the ribs together. The shoulder blades together, ribs open. Breathe in, reach high. Across the arms, intertwine the fingers. And breathe out, reach in front, hollow the back, the drill. Again, in the arms up. And breathe out the arms back, draw the shoulder blades together and out the chest to the sky. Again in, across the arms, intertwine the fingers, reach high. And out, reach in front, hollow the back. Breathe out. Again in. And out, back, draw the shoulder blades together, out the chest to the sky. Again in. And now we're doing eagle swings and ending with them. We're breathing in, lifting the arms up. Breathe out. Again in. Out. And the last time in. And out, lower the hands down. That was for backstretching. I thank you very much and until the next time.